Communication across cultural divides might provide unique challenges at each level of the encounter, and due to cultural differences, some patients leave the office not knowing what they were just told. This three-function model is particularly useful in demonstration of doctor-patient communication and may be used in cross-cultural situations. Instead of cutting to the chase, it's important to first establish a healthy relationship with the patient. Function 1 of this model describes the best way to do this when a language barrier presents itself. To climb over this barrier, you'll need the assistance of an interpreter. Though there's more convenience in having a friend or family member of the patient as the interpreter, one's professional expertise is more often than not the best choice. Other important considerations while questioning a patient in the presence of an interpreter include speaking in a normal tone of voice, avoiding slang or phraseology, and asking only one question at a time. It's also crucial to recognize the significance of nonverbal communication. One important attitude to remember is that gestures are not universal. In a worst-case scenario, a gesture you personally interpret as hopeful or optimistic could be interpreted as offensive or discouraging by the patient. Generally, it's best to avoid gestures and stick with concise, clear language. Other forms of nonverbal communication include eye contact and personal space. Different cultures perceive these modes of communication in different ways. Western culture ties prolonged eye contact with truthful speaking, while members of other cultures might interpret the opposite. Thus, a basic understanding of diverse cultures serves as beneficial to establishing a good relationship with the patient. Function 2 approaches the crucial aspect of the doctor-patient interaction of when you assess and inform the patient of their problems. Arthur Kleinman defines diseases as abnormalities in the structure and function of body organs and systems, while he defines illnesses as experiences of disvalued changes in states of being, or in social terms, the human experience of sickness. Specific cultural norms and personal beliefs impact how a patient feels his or her biological disease. The clinician should comprehend the patient's explanatory model of sickness by concentrating not just on the disease diagnosis, but also on the illness behavior influenced by cultural norms. To successfully demonstrate the third function, the art of negotiation is crucial in cross-cultural communication during the latter half of the encounter. Cole and Bird's model provide a few tips for success. Before conveying what they need to know, tell the patient what they want to know. For example, if you discover throughout the encounter that the patient's greatest worry is that his or her constellation of symptoms indicates an underlying cancer, make sure to discuss how likely or unlikely you believe this scenario is. When presenting diagnostics and treatment, recognize and respect the role of the family in medical decision-making. Be sure to inquire about the usage of culturally relevant treatment and request the patient to repeat your instructions to ensure that they understand.